All right, well, good afternoon. We are busy on the House floor today working on Minnesota's budget. Later this afternoon, we will bring up the HHS bill, or the Democrats will, from what we understand. We are concerned, to say the least, about this bill. Unfortunately, at a time when Minnesota has a $1 billion budget surplus, Democrats are breaking their campaign promises, and this bill will raise health care costs for every Minnesotan. It will cut funding for care for our seniors in nursing homes, and it will fail to address the rampant fraud in child care and other public programs. We think this bill falls woefully short of what we could and should be doing to take care of Minnesotans here in this state, given our financial position. So this bill is more than 1,100 pages long. We actually think this is the largest bill ever to be passed in state history. We'll try to find out if that's actually correct and get that information for you. And this coming from a caucus that said that they weren't going to do these big bloated omnibus bills. The bill has a ton of controversial policy provisions, again, from a caucus that said they weren't going to and didn't like to put policy provisions into finance bills. And frankly, we think this bill should go back to the drawing board and start over. Senate Republicans have been very strong in saying that these sorts of things are a non-starting point, and here we are in our fourth month of the legislative session, and Democrats are so dug in on these positions that it really makes it difficult to see how we finish session on time with them being this far off of what we think is a realistic bill. So again, to summarize this bill, Democrats promised on the campaign trail that they were going to lower health care costs. I think every member of the legislature promised they were going to lower health care costs, and this will be not the first vote this session, and certainly probably not the last, but this bill will raise health care costs for every Minnesotan, and we think that's incredibly concerning. It will cut funding for nursing homes, and it will let fraud continue to run rampant in DHS. So those are just some of our concerns, and some of the other members here will go in a little greater detail. So, Representative Schumacher.
Funding for nursing homes?
Sure. Well, from what has been projected and what the nursing homes have been basically putting their budgets together from the quality incentive piece that gets added to the overall funding formula for the facilities gets shifted so that the cap on what can be given in that formula is reduced. So the lower quality groups or facilities that are getting rate bumps now to try and help improve their quality, that's being reduced and given to the people who already have pretty high quality. They're projecting about a $68 million savings over the next biennium just from the savings that.
If this bill becomes law, nursing homes will get $68 million less than they would under current law. That's a cut of $68 million.
That's not less year to year, that's a reduction in the increase?
From current law, yeah. No, it's, don't get into the increase or it's, if this
I'm
bill.
trying to get as specific as I can
If this bill passes, nursing homes will get $68 million less than if this bill doesn't pass. You can't get any more simple than that. This is a $68 million cut to nursing homes, period.
And to that 68 million is also matched by federal dollars, so it's actually whatever 68 times 2 is at this point. But thank you everyone for being here this afternoon. My name is Joe Schumacher. I'm the Republican lead for the Health and Human Service Finance Committee. Throughout this session, Democrats have brought forward proposals in the HHS Finance Committee that are going to raise health care costs, from the restoration of the sick tax to the new tax on insulin and a one-care proposal that won't lower rates. They're failing to keep their promise of lowering health care costs. One of the most egregious parts of the bill is the fact that they are replacing reinsurance, which is a proven way to lower health care costs, with a subsidy program that costs taxpayers more, helps fewer people, and won't do anything to stabilize the market and prevent huge premium spikes of 50% or more. With that, I'm going to turn it over to Deb Keel, our HHS policy lead.
Thank you. Good afternoon. I'm Deb Keel, and I'm from Crookston, Minnesota. I am the Republican lead for Health and Human Services Policy Committee. I want to highlight the harmful cuts that we just talked about in the Democrats are making to nursing homes in this bill. As you heard, the changes are going to be about $68 million cuts in the nursing homes. It will be over 4 years. And while they're claiming they're going to fix that formula, in real life, the impacts are going to be devastating. I have had some conversations with my providers. I had an administrator in my office in tears. She said, I'm finally going to see our budget in the black. They're struggling to be able to fix a roof. And she's very proud of the fact that they were able to provide their staff, especially their sports staff, with increased wages and some benefits, and that's their goal. They're very challenged by being able to employ just anybody in that field, in the nursing home field, because the demand is so high up in the Northwest for employees, and this is a challenging job. They can find better benefits and higher wages in other businesses that are very successful in the Northwest area of Minnesota. I'd like to point out I asked one of my nursing homes, a couple of my nursing homes actually, to give me a few comments on what you're doing, what's going on, and what your staff is saying. And I had one of the residents' family members say that her mother considers her new private room her own apartment. Just a room, but that's her own apartment. And it has really improved her mental well-being. And as we look to make sure we take care of the seniors, as we're watching a lot of people age, I believe it's 60,000 this year will turn 65. My district is heavily aging, and we don't have the facilities. I would comment that one of my administrators said the single bed incentive to help them remodel created 38 private rooms and bathrooms. So they have a lot of better dignity, better for their residents. And she commented that people seem to be much happier with where they're at. It's challenging to move into a nursing home when you think you're independent and you need that help. And I had Activity even say they were excited about the fact that they were able to replace a tub. And a tub is a big deal in a nursing home. And something that's safe and warm is really important. So a cook even was excited about a new stainless steel counter. The last time they replaced that was 1972. So, and they are 95% full. This is a very city-owned, active nursing home. I hear a lot of great things about it, and they're really working hard. One of the nurses' aides also said they could purchase another lift so they didn't have to go down one wing and go run and get it for the other. Think about the people that need to get to the bathroom that need that lift. It's really important, and the nurses can move them much quicker and at the efficient rate that they need to be. So with a $1 billion surplus, these changes are inexcusable. The formula needs fixing. Let's do it in a way that won't harm our aging loved ones. So with that, I will turn it over to Representative Gruenhagen.
Thank you, Deb. I'm Representative Glenn Gruenhagen from District 18B. In this bill, the Democrats are taking the first step toward a massively expensive government takeover of our healthcare system. They are spending Minnesota's tax dollars to study and come up with legislation for single payer. Minnesotans would lose their choice in health care. They would get lower quality care. It would require massive tax increases. And the low reimbursement from government health care would endanger the financial ability of our doctors and hospitals, especially in rural Minnesota. For this reason, states like California and Vermont have abandoned the single-payer healthcare system. It is impossibly expensive, removes all choice from our healthcare system, and would lead to a financial disaster with less health care for our citizens, especially those who are critically ill. Now I'll turn it over to Representative Franson to talk about fraud provisions in the bill. Thank you.
Thank you, Representative Gruenhagen. I'm Mary Franson, the Republican lead on the Early Childhood Division. House Republicans are very proud to have been leaders on preventing fraud in the child care and other public programs. However, sadly, we did not have a bill that, we have a bill that falls woefully short in addressing this very serious problem. Democrats simply do not, and still do not, take this issue seriously. And I have my doubts. We all have our doubts in my caucus, whether or not the House Democrats truly believe there is a problem in the child care assistance program. The Early Childhood Division held 19-minute meetings before we finally heard from someone in DHS who could answer questions about the scope of child care fraud. Democrats rejected our motions to subpoena Carolyn Ham to come before the committee. In fact, the chair confirmed he had not even asked her to appear. This bill puts millions of taxpayer dollars into a system riddled with fraud with no safeguards to assure that money won't be going into the pockets of those looking to defraud the system. This bill may include some penalties, but certainly doesn't give the prosecutors the tools they need to prove intent. It totally ignores the single biggest recommendation from the OLA that we make the Inspector General an independent office. Time after time, Democrats have refused to take meaningful action on the issue of fraud, and Minnesotans should be outraged. In fact, many are. With that, we will open it up for questions. Thank you.
Questions?
More than 100 amendments again today?
Yeah, probably, something like that.
The speaker.
It's 1,100 page.
1,100 page
so-
bill, right. The speaker said at her avail a little bit earlier that they had a health issue with one of their members, I guess, last night because of the length of the session.
It was actually one of our
Was your-
members.
your
It had
members, I'm
nothing to
sorry.
do with the length of the session.
okay.
It was an allergic reaction, and she shouldn't use people's health to try to make a case that we should pull the wool over the public's eyes about, not knowing what's in these bills and not having an opportunity to debate them and vet them fully. I think she knows better than to do something like that.
I know all amendments are loved by someone, but can you maybe give us some idea of where you're going to look today to make changes in this bill?
Do you want to take that one maybe, Joe? Where the
Oh, we
priorities
have
are.
a whole area, but I think the area to focus on mostly is the Healthcare Access Fund and the provider tax that's included with that. We have a series of amendments that will be coming forward by Representative New, actually, to restrict and carve out different diagnoses and treatments for that, so that the sick people who have cancer, the sick people who have diabetes, or one of the other ones that she's doing, to make sure that those people who are sick aren't being taxed and have that carve-out piece. And I think that's going to be one of the big highlights, is just, one, identifying that the provider tax is a sick tax on people, and that this is one way to try and get around and fund some of that.
Yeah, I'll just add, again, as Representative Daudt said, all of us campaigned on lowering the cost of health care. And today, the Democrats are going to vote to increase the cost of health care. And we see the writing on the wall. They want to tax health care. And so we're just looking for a little bit of relief where we can through some of these amendments. Not only is this taxing everyone, it increases the cost of health care, but it's immoral. This is making having cancer be a taxable event. And we are saying that's wrong, and we're trying to get that carved out of the bill and some other things.
Will there be standalone votes, say on one care, or the problem with omnibus bills is the yes votes are all mushed up together. The only way to really get independent votes sometimes is for an amendment to take something out. So
Sure, we've got it, like we said, probably close to 100 amendments. So we're going to address a lot of things in our amendments. I don't know that like I said, mine are primarily regarding the provider tax, but yes, we'll pull out a number of things so that we can try to fix a really bad bill.
Any of your amendments or proposals that you'll have today address the funding gap that will be left if the provider tax goes away? I know that there's been discussion through cost savings or other revenue streams that the state already gets in order to fill that gap, but are you making a proposal to do something else with it in order to cover, I think it's $900 million in 2023, that biennium that the state doesn't have anymore because of if the provider tax goes away?
Sure. A couple of things. One, we have $1 billion budget surplus. We actually don't have to do anything to find that money. We have $1 billion budget surplus. The money already exists. We don't have to find more money. And I think that's what's particularly offensive about this. I mean, the Democrats are proposing billions of dollars in tax increases, and they're cutting funding to nursing homes. They're cutting funding for our seniors. So no, we don't need to find additional sources of revenue. The money already exists.
Anything else? No. Thanks, guys. Thank you.